Now let's move on to part 2. Here we're going to discuss about challenges of management. What do you mean by challenges of management? So always the challenges of management is a secret of success in a sports and exercise medicine team. When you look at the athlete, always we have to look at the broader view of their problem. It's not the narrow view. What happens when you look at them or look at their problem in a narrow view, at the end it will be a failure. So I'll just give you an example. So in what way you have to think about athlete's problem or athlete complaint. Now let's take an example. Let's take an example for a narrow view. Your runner who is presenting to you with a shin pain, and then you have diagnosed him to have a stress fracture of the tibia, and he's been treated with the rest until the free of pain. Although it is likely that it's short term, definitely the athlete will improve because he has been under rest for a while as you advised, and then he'll be able to return to activity. There remains highly likelihood of recurrence of an injury. Because so we haven't diagnosed the conditions. We have diagnosed as a stress fracture. We weren't aware whether we have provided him adequate rest or not. But still, the athlete, once he becomes pain-free, he has returned to activity. But also there is a possibility of reoccurrence of an injury. So here the clinicians should ask, why has this injury or illness occurred, which means past history. The cause may be obvious. For example, a reason sudden doubling of training load, or it may be subtle, and in many cases it's a multifactorial. So always, as we discussed earlier, the clinician should have a thorough knowledge and skills to appropriate according to the demand of the sport or demand of an individual. So here, as I said, a runner who is presented to you with the complaining of shin pain, he has diagnosed to have a stress fracture. So what else we have to diagnose it, or a clinician should diagnose it? As we discussed, always we have to have a prehistory because it helps in rule out is there any chances for recurrence, or is he loaded more, or is he done any other activity which has not been provided by a sports physician or a sports physiotherapist. Do you know the greatest challenge of a sports and exercise medicine is to identify with the shin pain the causes for the shin pain or injury, since a runner with the shin pain arising from a stress fracture may have abnormal biomechanics, inappropriate footwear, change of training surface, maybe you would have modified from hard surface to soft surface or even surface, or change in quantity or quality of training, maybe he might have loaded more or he might have loaded less. So it's called imbalance in training aspects. Always when you talk about challenges of management, there are two challenges. One is diagnosis and treatment. These are the two significant challenges that we face day to day when we being as a sports physiotherapist in a sports medicine team. So what do you mean by diagnosis and treatment? In a sports and exercise medicine, it is necessary to diagnose both the problem and cause, which will help us to treat them better and better. Now, as we discussed, there are two main challenges in a management. One is diagnosis, one is treatments. So what do you mean by diagnosis? Who is the victim here? Who is the culprit here? What do you mean by diagnosis? Diagnosis is when you do every attempt to make a diagnosis, always you should have a precise anatomical as well as pathological cause of presenting problem. So it's a site of pain, always site of a dysfunction. For example, if patient is complaining of knee pain, who's presenting to you with the anterior knee pain? So we should have a basic anatomical knowledge of the knee, and then pathological causes. What could be the possible factor for knee pain? So it's one of the challenges of management. It's a diagnosis. Normally, when you have a thorough knowledge about anatomy, especially the surface anatomy, and the understanding of pathological process likely to occur in an athlete, often permit a precise diagnosis. Instead of using a purely descriptive term such as shin splints, as we discussed, instead of using a precise diagnosis, sports physicians or a physical therapist should attempt to diagnose which of the three underlying causes for the knee pain. It could be a stress fracture, it could be any compartment syndrome, or it could be any periosteitis. Anything could be. So we should attempt to diagnosis, and then what are the underlying causes. Always when you do a accurate diagnosis, when you diagnose it correctly, it guides a precise treatments. If your diagnosis is clear, and then your interventions will be perfect. However, sometimes the clinical situations do not allow a precise anatomical and pathological diagnosis. For example, in a cases of low backache, it's clinically impossible to differentiate between potential sites of pathology. The diagnosis of the presenting problem followed by a diagnosis of the cause of the problem. Then I have mentioned it here, who is a victim and who is a culprit. It's been purely described by a Ben Kepler. He is an US orthopedic surgeon. The term victim is for a presenting problem, and then culprit for the cause. So we have to have both victim as well as the culprit, diagnosis and for the causes. Do you all agree? Yeah. Now, let's look at the scope of sports physiotherapist in sports medicine team. So what are the scope of a physiotherapist in sports medicine team? First, let's have a look. So what is the role of sports physiotherapist in a sports medicine team? It is a basic function of a physiotherapist in a sport is the application of a treatment by physical means. It could be electrical, it could be thermal, it could be manual therapy, or it could be other alternative therapies. Based on the World Congress Physical Therapy on physiotherapy in sport, they described that this is the set of methods, techniques and performances which through the use of application of physical agents which prevents recover and readjust a person with sport or exercise injuries at the different level. Now, let's look at the principles. So there are 6 principles. These are the scope of sports physiotherapist when you are working in the sports medicine team. So the first one called outreach in sport. What do you mean by outreach in sports? Here the sports physiotherapist, they will advise the sports people and professionals linked to the team and perform any actions. Why? Because that helps to improve the conduction of avoidance of injury to an athlete. Now, what is prevention? Here, the physiotherapist should be alert. Why the physiotherapist has to be alert? Because he has to avoid as far as possible all those factors that might bring up injuries. Now, let's move on to recovery. What do you mean by recovery? Here, the physiotherapist should regain the functionality of an athlete quickly as possible. Also, they have to accelerate the biological process of recovery from injury to limit the training as little as possible. In order to enhance the recovery, so the first primary responsibility of a sports physiotherapist is to regain the functionality, accelerate the biological process, limit the training sessions. Now, let's have a look what is rehabilitation. What do you mean by rehabilitations? So rehabilitations, the role of sports physiotherapist, a scope of physiotherapist in rehabilitation to rehabilitate the injured athletes or those who have been suffering from chronic injuries. They have to rehabilitate, and then the player has to return to play as early as possible. Then what do you mean by teaching? Here, the sports physiotherapist should aim to improve all the facets of knowledge that contribute to the training of top professionals in the team sport. Which means, as being a sports physiotherapist, we have to have update, thorough knowledge and innovations, and then has to be incorporated into the top professionals team. And what do you mean by research? Physiotherapist in sport should conduct studies that can contribute to the prevention of injuries and the treatment by a physiotherapist, which will help in enhance the performance of the team, not only the player, it will enhance the performance of the entire team.